This is pharmacist Kevin Hope, and welcome to 5 Minutes with a Pharmacist. Today I'm here with pharmacist Michael Collins. Michael is the owner of Healthway Compounding Pharmacy in Saginaw, Michigan. Now, Michael, you've had the pharmacy there since 1985, and I can imagine that a number of things have changed, not only on the regulatory front, but also on the way that we interact with patients. So Michael has a very innovative practice. We were chatting just a little bit before the session today. So Michael, why don't you tell us a little bit about some of the things that you're doing there in Michigan?
Thanks, Kevin, for having me on this little program. We talk to a lot of different students and physicians that come into our practice to see what compounding pharmacy is all about, because it is kind of a unique part of pharmacy and very unusual. There aren't as many compounding pharmacies, obviously, as they are community retail settings. And so we're kind of unique, and we're also kind of unique in that we decided many years ago, when I bought my first traditional pharmacy, it was a regular 5,000 square foot store with a whole bunch of SKUs and sold everything, including had a soda fountain. So back in the day when that was popular. And then as I decided to start transition, our pharmacy over to a more professional looking model, then I picked up on a trend really that was back in the 60s, a small group where they were trying to create an office style of practice. And so I really got excited about that idea about practicing pharmacy in a professional office style of setting, as opposed to in one of these big large stores that has many different things, and focusing just on pharmacy. And so what enabled me to do that was getting excited about compounding and revitalizing basically the ancient art of compounding. And there was an incredible need for it, because all of a sudden the manufacturers were changing. They were discontinuing products. They were deciding that certain things weren't viable financially for them to create anymore. And so patients were coming out of the woodwork looking for dosage forms. I remember one of the first things I made was an old Cafergot PB suppository formula, where this patient was having difficulty finding them, and it was the only thing that worked on her headaches. And so she came to me and said, I can't find this anymore. It's not in the market. I don't know what I'm going to do. It has 50 ingredients in it. And so I was able to find formula, source all the ingredients, and make the suppositories. And I made those for her for probably 15 years, and she was really happy with them. So we were meeting a need, and compounding pharmacy today continues to meet a need in that patients, now remember, there's a lot of four-legged fur babies out there that are our patients too, right? And so everything from snakes to parrots to dolphins, if you work with a zoo, or elephants, rhinoceroses, all kinds of animals need medications, and they need them made in a way that they can administer them. And typically the things that are manufactured may not be the right strength, flavor, color, dosage form, whatever. So it's often falls upon compounding pharmacists to be able to solve those problems as they come out, or as they come up. So we do about 25% of my business is actually veterinary pharmacy, and so the rest of it is human, everything from pediatrics to geriatrics, basically. With very few exceptions, I almost work with every single prescriber out there. It's quite often that pharmacists will say, well, you must just have a lot of dermatologists that you work with. Say, well, dermatology is a small part of our practice, surprisingly. Actually, there's a lot of other medications. For example, we have a pretty large infertility clinic nearby. And so we have to create a lot of different dosage forms of hormones to help with these ladies to stay fertile or maintain a pregnancy. And so just that is one little piece, but as actually a big part of our practice too. So as we were talking about earlier, Kevin, a lot of times pharmacists will come to me, students, as they're coming through, and say, if I wanted to get into compounding pharmacy, how do I do it? Because a lot of times most pharmacy schools aren't even really teaching compounding where we have a wet lab anymore. They might talk about compounding, but they really don't teach them how to make ointments and suppositories and eye drops and ear drops and things like that.
You're right.
So a lot of pharmacists or students will come to me and say, where do you get trained? And so I myself personally got trained at, I think, the best in the business, and that's PCCA, Professional Compounding Centers of America in Houston, Texas. They still train many, many, many pharmacists today. I think that they're single-handedly trying to keep the independent community practitioner alive and well by looking for opportunities to be able to keep them profitable when we know the insurance companies are continuing to take money away from us. So we're trying to do our best at finding alternatives that will make, pharmacy survive.
Michael, it sounds like you have a fantastic practice there in Michigan. And so thank you so much, folks. Again, this was Michael Collins from Healthway Compounding Pharmacy in Saginaw, Michigan. And thank you so much for joining in for 5 Minutes with a Pharmacist.